everyone, welcome to Scripts in Science. In today's video we are going to learn about dialysis. First we understand what is the dialysis and what is the definition of dialysis. Dialysis is the artificial way to excrete the waste and excess fluid out of the body, right? When your normal kidney is not functioning well, it's an artificial way to remove the waste. मतलब आपकी अगर किडनी खराब हो गई है तो कुछ तो चाहिए ना जिससे हम हमारी बॉडी के अंदर जो वेस्ट मटेरियल है हम बाहर निकाल सकें, ठीक है. सो हमें एक डायलिसिस इज एन आर्टिफिशियल वे टू रिमूव द वेस्ट. नाउ in which cases, in which situations we can use dialysis. Okay, हम उस केस में यूज करेंगे जिसमें किडनी की प्रॉब्लम है. First, like kidney जिसमें डैमेज हो रही है. Like there are two situations where the kidney is damaged. Like first is AKI, acute kidney injury, right? And second is chronic kidney injury, chronic kidney failure, CKD, is the last stage end stage renal disease where the GFR, glomerular filtration rate, is less than 15. We are going to proceed with this procedure, that is dialysis, right? Now understand how it works. What is the principle behind it? As we already learned that in our previous classes, there are three things are there. First is diffusion. We already know that what is diffusion. ठीक है. Next है हमारा osmosis. And third one is ultrafiltration. And what is the principle behind it? First one is diffusion, osmosis, ultrafiltration. We learned all these things in our earlier classes. Here, how diffusion, osmosis and ultrafiltration works. Here we are using a semi-permeable membrane, and this semi-permeable membrane, on one side there is dialysate solution, there is a dialysate, and another side is the blood, right? And in between there is a semi-permeable membrane. In peritoneal dialysis, there is this peritoneum acts as a semi-permeable membrane. Now what happens, there is a dialyzer in which there is higher concentration of solutes, and in the dialysate it consists of minerals, water and some of the electrolytes, right? And this is of higher concentration than the blood, right? So this on this side the higher concentration present in the dialyzer solution, and here in the blood this is of low concentration. Now what we understand, how this diffusion, we use this diffusion ultrafiltration principle here by using a semi-permeable membrane. Just imagine this is the semi-permeable membrane, on this side this is the dialysate solution, and on this side this is the blood in which the waste material and excess fluid is there. Now we use, this is the higher concentration of solution is there. Now what happens, this waste material is just passing through across this semi-permeable membrane, and it just excreted out through this dialysate solution. Now, and this blood is now clean. Okay, so this is the principle behind it, and in hemodialysis also the same principle applies. There is a dialyzer is there through which the waste material is excreted out of the body, right? This is the composition of dialysate. Dialysate में ऐसा होता क्या है जिसकी वजह से there becomes highly concentrated solution, right? First one is, this is sodium, potassium, chloride, calcium, magnesium, acetate, bicarbonates, lactate and glucose. Okay, these type of things are present in high concentration in the dialysate solution, right? Now, okay, first one is hemodialysis. What is hemodialysis? In which the waste material excreted out of it through the dialyzer, right? And what is the dialyzer? Dialyzer is a hollow fiber, is a flat hollow fiber. Just see in this diagram, this is a flat hollow fiber, and the cellophane tubules that is present inside it act as a semi-permeable membrane. And the same principle like diffusion, osmosis and ultrafiltration applies here, right? Now what is present in the dialyzer solution? This is the dialyzer. Now what is present in the dialysate solution? In the dialysate solution, what is the composition, right? If I'm talking about the composition, what is the composition? first is a lot of minerals, glucose, lactate, acetate, sodium, potassium, and a lot of minerals, water. This is present in the dialysis solution, right? Now, before doing hemodialysis, some of the things that we have to keep in mind. First is, before doing hemodialysis, we have to do a minor surgery. Minor surgery includes, first is AV fistula, second is AV graft. AV fistula means arteriovenous fistula, and arteriovenous graft. In arteriovenous fistula, there is arteries and the veins are connected, and in arteriovenous fistula, just see in this diagram, a patient lying down on the bed, and this is the hemodialysis machine, right? And we have created arteriovenous graft or arteriovenous fistula. Now the blood is coming from one side, that is the venous end, and is entered into the body from the artery side, right? And here you see there is a dialyzer also, and this acts as a semi-permeable membrane, and this is based on the principle of diffusion, osmosis, and ultrafiltration. And another thing is that always in between the dialysis, in between hemodialysis, we have to make this thing patent. For that, we have to fill this machine with the heparin solution, so that there is no clot formation in between in between the line, right? In between the line, heparin should be filled in this hemodialysis machine, so that it is not blocked anymore. There is no clot anymore, right? So hemodialysis हो गया. Now, if अगर ये इतना easy है, ठीक है, hemodialysis is done. Okay. Now about the complication. In complication, first is the infection. Whenever you are doing any invasive procedure, first is infection is there. So do the procedure in a very sterile way. Second, the air embolism. The air get trapped and cause the emboli formation. Now what we are doing, we have to first of all stop the dialysis. ठीक है? तो हमें dialysis को stop कर देना है for some time. Tell the patient to lie down on the left lateral side and head down. Why we are doing this? Because we want that air is not able to enter into the lungs, right? So cause further complications. So that air, tell the patient to on the left lateral side and head down, and so that air get trapped on the right side of the atrium and prevent the further movement into the lungs, right? And give oxygen, check the vital signs of the patient. If everything is sorted out, everything is now fine, then we can restart the dialysis. Now third is muscle cramps. Why there are muscle cramp? Because there is a shifting of electrolytes from extracellular fluid to the dialyzer, so that's why there is a muscle cramps will be there. Next is hypotension. So we have to tell the patient not to take any antihypertensive medication before the procedure, right? There is a thrombus formation always, so we have to keep in mind that in between the procedure, in between the dialysis, the heparin should be in the dialysis machine, so that there is no clot formation in the machine, right? So these are the complications, and we have to have a check on that. Next is, we are talking about peritoneal dialysis. Key points that we should keep in mind when we are doing hemodialysis. First of all, we have to check the weight of the patient before and after the procedure, and also you have to keep in mind that the body temperature after hemodialysis will be more, because because of the warmer solution that is entering into the blood. So we should not worry about this. Okay. And third thing is that the vital signs, temperature, pulse, BP, everything we have to check after the procedure and also before the procedure. Okay. And there is also chances of dysarrhythmia. We have to, because there's electrolyte imbalancing is there, so we have to check there is any changes in the ECG, and these all things we have to check. We should not leave the patient when the patient is undergoing hemodialysis, right? Now we are talking about peritoneal dialysis. What is happening in peritoneal dialysis? Like hemodialysis, there is some minor surgery is performed also here. Here we are using a PD catheter. The peritoneal dialysis catheter is inserted is 3 to 5 centimeter below the umbilicus, where there is no major blood vessels are there. We are inserting a PD catheter. PD catheters like Swench, there's Tankov, these catheters are being used, right? And first of all, we have to take the informed consent. Informed consent is necessary. Take the vital signs of the patients, and next is, we tell the patient to empty the bladder to avoid any injury to the bladder, right? So, and Swench, Tankov made of, and these are made of the silicone material which is radio opaque. Okay. Now we are talking about peritoneal dialysis. Here in peritoneal dialysis, peritoneum is act as a semi-permeable membrane. Same principle like diffusion, osmosis and ultrafiltration is used here, right? Before doing peritoneal dialysis, a simple minor surgery is performed, and for that surgery, informed consent should be there, and there is we tell the patient to void, tell the patient to empty the bladder, because maybe if there is a bladder is full, there are chances of bladder injury, because we are inserting a PD catheter, right? And PD catheters are inserted below the umbilicus 3 to 5 centimeter, because there is no major blood vessels are there. So we are inserting below umbilicus, below 3 to 5 centimeter from the umbilicus, right? So, and another thing, and this PD catheters are of silicone, made up of silicone, and they are like, examples are like Swench and this Tankov. These catheters are being used, right? You see in this diagram, there's a patient, there's a dialysis bag, there's a drainage bag, and PD catheter is placed. It depends on the three principles. First is, it depends on the three processes. There's 3 steps are involved in it. First is infusion. We infuse the drainage inside the body. Then there is a dwell time. Withhold that solution for a prescribed period of time. Then there's a drainage. Then we drain out that under the influence of gravity into the drainage bag, right? First हम क्या करते हैं, सबसे पहले डायलिसिस सॉल्यूशन को बॉडी के अंदर, एब्डोमेन के अंदर डालो, ड्वेल करो, वहाँ पे थोड़ी देर रखो कुछ टाइम के लिए, एंड देन जब सब कुछ हमारा डिफ्यूजन, ऑस्मोसिस, अल्ट्राफिल्ट्रेशन, इस प्रोसेस से सब कुछ हमारा वेस्ट मटेरियल वहाँ ब्लड से बाहर आ जाए in that dialyzer bag, then under the influence of gravity, this excess waste is under the influence of gravity collected in the drainage bag, right? Infusion, dwelling, and then drainage. These are the 3 steps. सबसे पहले infusion करना है, dwell करना है थोड़ी देर, then we have to remove that waste material in the drainage, collect the drainage bag. Now understand, just see that this is not only the step. We have to see that in the drainage bag, that waste material is colorless or straw colored or colorless is there. If it is cloudy, so there's a chances that there's infection is there. There's peritoneal membrane get inflamed. There's peritonitis can be there in that situation. So we have to treat the patient for peritonitis, right? Now we understand what is the complication. क्या complication हो सकती हैं जब आप peritoneal dialysis कर रहे हो. सबसे पहले तो ये चीज़ है कि हम higher concentration of glucose we are giving, so there is a chances that the patient can have hypertriglyceridemia, right? Triglyceride की hyper ज़्यादा concentration हो सकती है, और the peritoneal membrane is used most of the time. The abdomen की peritoneal membrane that is being used, so there is chances that abdominal जो wall है that is become weak, so patient can have abdominal hernia, right? And there's chance of infection. We already learned this. The peritonitis and thrombus formation. There's anorexia, nausea, and this thing can be happen. There is also chances of bleeding. So we have to see there's any clot or something, we have to keep in check. Okay, so this is all about peritoneal dialysis. And now we have to see uh, the various types of peritoneal dialysis. First one is acute intermittent peritoneal dialysis. This is done in unstable patient, hemodynamically unstable patient. This dialysis is done with the help of PD machine. Next is continuous ambulatory peritoneal dialysis. In the continuous ambulatory peritoneal dialysis, during the dwell time, patient can move around, and when the dwell time is over, then the patient is lies down, and the third step is being done, that is the drainage, right? Now third is continuous cyclic peritoneal dialysis. This is done at night. Here the 3 cycles are being done at night, and one cycle, in which the one cycle having the 8 hours long dwell time, and after that the drainage is being done. So we have in peritoneal dialysis we have 3 types of peritoneal dialysis. First is acute intermittent peritoneal dialysis. Second is continuous ambulatory peritoneal dialysis. Next is continuous cyclic peritoneal dialysis, right? Okay, now understand about peritoneal dialysis, hemodialysis, how it is performed, and about the efficacy. Efficacy is both in hemodialysis and peritoneal dialysis same, but it doesn't do all the function of kidney. What our normal kidney does, they are not doing all the functions of the kidney, but okay, now our kidney is not functioning well, so this is the side thing that we are doing. Next is about the health education. What health education we will give? First of all, we have to tell the patient to do the regular follow-up, to do the dialysis, hemodialysis at proper interval, right? And next is about the diet. High potassium diet, high phosphorus diet, high salt intake, and high sodium intake. This all should be avoided, right? Avoid all the things which has high potassium, high phosphorus, high sodium, and the high salt. There's a big no for it, right? And another thing that there are also, and there is a drink less fluid. Tell the patient to take the fluid in a limited quantity. बहुत कम पानी पीना है, बहुत कम juices, liquid intake should be less, right? And but all the thing is there, but here high protein intake should be there. ठीक है, protein intake लेना है, because during that procedure protein is excreted out from the body. So here we have to tell the patient to take high protein diet, but high potassium, high sodium, high phosphorus, and high salt. This all should be avoided, right? Now, but what to tell the patient? What to eat? Because patient doesn't know about high potassium and high phosphorus. We have to tell the patient that, okay, this is all about peritoneal dialysis, hemodialysis, complication, health education, everything is being covered. But if something is missed, please let me know in the comment section. If you found this video useful, please like and share, and thank you so much.